Welcome back to Burst TV. My name is Charlotte, and I'm here to introduce this next segment that I hope you will all find very interesting. So, I was a typical clinical hygienist working in a single doctor practice, a private practice, for many years. Over 18 years, in fact, in that same office. So I find it incredibly exciting that there are ways that dental patients can get care from qualified dental professionals in non-traditional ways. Now, these non-traditional means may one day be very typical, but I'm super interested to hear more about this kind of stuff. So before this whole COVID disaster began, I reached out to Virtudent to see if they'd be interested in sharing a little more about what they do. So in this video, we have Susan Walker. She's a fellow hygienist and the National Clinical Training Manager at Virtudent. The other voice you're about to hear in this video is that of Alexis Arlett. She's the Director of Corporate Marketing, and she was kind enough to hold a Zoom video conference, an interview with Susan, so we could learn more about her and the impact that this company is making for their patients.
My name is Susan Walker, and I am a registered dental hygienist for Virtudent.
Can you talk a bit about Virtudent and what it is?
It is a teledentistry company. So we're really focused on our mission, which is bringing high quality dental care to all. We do that in a few different ways. So the first way we do that is we have on-site services that are a hygienist bringing in portable dental equipment, and we see patients right at their work. The other way that we're doing that is we do have an online teledentistry platform. This is a way for patients to reach out to us if they have questions or urgent concerns, and we help with triaging and care coordination for them.
What initially drew you to Virtudent?
So I've been a hygienist for a little over 7 years, and I think like a lot of hygienists, I was in private practice for a while. I definitely wanted a change, wanted to kind of be a part of something a little bit bigger than where I was. And just very interested in their model with Virtudent. I think it's been just opened up a lot for me in terms of experiences that I've been able to have. We really are trying to address issues around access to care, just ways that, it's enabled me to reach patients in a much more bigger way. So it's been really rewarding.
What do you think of the work that you do, and can you describe it a bit?
As part of our model, we're getting care to those who might not have otherwise been able to receive it. It's been challenging for them to get care. So, we really see people who, whether it's in our on-site services, who may not have seen a dentist for years, and then you can really see some of the really tangible benefits of just getting preventative care, getting them back on track. So being able to really be a part of that. With our teledentistry consults, we are helping people, especially right now with what's going on with COVID-19, obviously a very stressful time. And we're able to kind of reassure those patients, help them using, as much as our resources with teledentistry allow us to be able to do, and really connect those patients to the care they need, answer their questions. Really keeps what we do very patient-centered, very rewarding.
And what do you think makes Virtudent so special?
We have a really great team. We all really care about our mission. Having, really high ethical standards is very important to everyone on our team. So, we work together to, do what we need to keep things patient-centered. We focus our recommendations on what patients need and what we're seeing, and what kind of care they need. We really keep that emphasis on prevention, helping people moving forward, that we're there for them. So I think just having that very high ethical standard is always there.
Why do you think the work the company is doing now is so impactful?
I think bringing access to care is always important, and something that's certainly very needed, but especially during, what's going on with COVID-19 and how stressful this can be for so many people. Finding a dentist if you have an emergency is obviously really, can be scary. And so, speaking to one of our dentists and hygienists and kind of feeling reassured, or any steps that we can do to help during that time is just so important. And I think it really shows in a broader sense what the importance of teledentistry and kind of the role that that has, and what that can really do for the industry. So I do think there's a real future in that, and teledentistry is just a really important way to reach patients, especially now.
Where do you see Virtudent going over the next few years?
Virtudent has a lot of potential. I think teledentistry, especially with what's going on kind of currently, it really shows the role that teledentistry plays, and how, across in healthcare in general, this is something that really enables us to better use technology to connect to more people that need care. So I think now more than ever, it really shows a need for that. And I think, we are, looking into innovative ways that we can best use teledentistry. And I think it just makes it a very exciting thing to be a part of.
Thanks for watching, everyone. If you work outside of your typical clinical operatory, that setting, use virtual conferencing or digital technologies for your patients, I'd love to hear more about it. If you love content like this, make sure to subscribe to the channel, leave us a comment, ask any questions. This is definitely a community project, and we love to hear from you. This segment of Burst TV is not sponsored by Virtudent or any of their representatives. The purpose of this video and all Burst TV content is to share information, opportunities, and support our Burst community members on a professional and personal level, and to whomever else should pass by this channel. Thanks for watching. Have a great day.